So the difference between treating surrogate markers and actually addressing health is you look at what is the cause of disease. And it depends on what disease you're talking about. There's a little bit of genetics. There's a lot of environmental factor. Diet and lifestyle habits play a role. I don't think anybody disagrees with that anymore. There can be some disagreement as to the degree that those things play a role. But let's look at the food issue for a moment, okay? So we still have medical doctors who don't get any training in nutrition in school. I mean, Tufts University in the United States has the best training program for nutrition for doctors. It's 17 hours of lecture. That's it. And then doctors can talk to their patients about nutrition if they choose to. Most of them don't. But the reality is, here's the average adult puts through their system, their body, every year, a ton of food, 1 ton. So how can you make the claim that this wouldn't impact your health? Put a ton of anything through a human body. It's going to impact your health one way or another, good or bad. There's not much neutrality in the world, actually. Things are either going in a good or a bad direction. So a lot of the chronic degenerative diseases that we're seeing today, type 2 diabetes, cancer, cardiovascular disease, autoimmune diseases, a lot of these diseases have a strong nutritional component. And when you change the diet, you're addressing the cause. And so what you see is this often stopping the progression of the disease, sometimes reversing the disease. So I have a colleague at the Cleveland Clinic. His name is Caldwell Esselstyn. He started in 1985 with a very small group of patients, only 24 in the group. And these patients had experienced collectively within the last few years 49 cardiovascular events. 5 of those 24 were told they would not live till the end of 1985. They were placed on a plant-based diet, and 18 patients remained compliant. And all 5, by the way, lived until 2016. The first person died in 2016. So living 30 years longer than you expected to is a pretty good track record, I would say, you know. But anyway, 30 plus years. In any case, he's continued to do this type of work throughout the last 30 some years. It's the longest longitudinal study ever done on the influence of diet or the influence of anything. I mean, the drug companies do a trial for 6 weeks and then declare a drug effective and safe to take for the rest of your life. 6 weeks doesn't make, you can't make that claim after 6 weeks, but they do. So this guy's followed his patients for 34 years, published his data. You would think he'd be the toast of the town at the American Heart Association. Go to their website, enter his name in the search engine, and you find nothing. Comes up 0. I'll tell you what does come up. They have a certification program, the American Heart Association, for foods. Guess how you get that certification? You pay them a fee. You know what's on the pages? Pages and pages of bacon and pork tenderloin, 37 pages of animal food I counted the last time that and I have 8th grade kids who come to our center with their parents who know that pork tenderloin and butterball deep fried turkey breast is not health food for cardiac patients. And these people put this on their website with a straight face, along with a notice that says, we do not certify desserts. Well, thank God for that, because I was beginning to think they were ethically challenged, right? So anyway, this is the type of thing that happens. You look at the results from using dietary intervention, which is far less toxic, addresses the cause of the disease, versus using surgery, drugs, much more toxic, far more risky. And the results are spectacular for the vast majority of people who take the nutrition route. However, that option isn't presented to them, you know. And in the U.S., I don't know how it is here in Europe, but in the United States, you hear all these people chattering about, oh, Americans are lazy, they don't care about their health, they just want a magic pill. My experience has been totally different. Nobody is sitting down and saying to a patient, for example, listen, we could do angioplasty, okay? Now, we have some studies showing that randomize people to have angioplasty with stents and just plain angioplasty, and the stents actually make no difference unless it's an emergency situation. 6 months later, no difference between the 2 groups. So I could do that, and it costs your insurance company $50,000, and you have to pay a copay. Or I could and it doesn't change your risk of heart attack or stroke a bit, really. Or we could put you on a nutritional protocol. Let me show you this data from this guy up at Cleveland Clinic, or Dean Ornish, a name that's really well known. We could put you on a dietary protocol that doesn't have all these risks and actually does make a difference. What would you choose? A lot of people would choose the dietary route if they were shown, but they're not shown. Their learned cardiologists tell them the best standard of care, statin drugs, angioplasty, bypass surgery. And of course, every medical institution has what we call a cardiac cathedral, where they're performing these procedures. Most hospitals couldn't stay in business if they stopped performing them, or if they perform them appropriately, which is in emergency situations, not for folks who are saying, okay, I'm scheduling my surgery for a week from Thursday. That's not the appropriate use of these procedures. So the use of nutrition has been proven to be effective for cardiovascular disease, multiple sclerosis, inflammatory bowel disease, many other autoimmune diseases, type 2 diabetes. A guy at the University of Kentucky showed you could take insulin-dependent type 2 diabetics and have them off their drugs in 21 days. 24 out of 25 off their drugs in 21 days. For the type 1 diabetics in the study, 100% of them were able to reduce their medication by an average of about 40%. Significant. Leads to a longer life and less diabetic complications. So why isn't this featured on the website for the American Diabetes Association? Why is the Academy of Nutrition and Dietetics so much against the work that I do? Why did they spend all 5 years? 5 years is very expensive investigation for a government agency coming after me. Why are they so intent on getting rid of me? Okay, well, because when you teach diet, you're interfering with all those special interest groups, the drug companies, the ag groups, the food companies, the associations, which have really become a mouthpiece for industry. They're no longer serving sick people, in my opinion, most of the time. So anyway, we keep promoting this, and we're gaining a lot of ground, but it's an uphill battle because a cure like this that could be made available to patients will be suppressed as long as more expensive treatments are available and people are making money on them.